Hi teacher and everyone, my name is Melanie Aguilar, radial fracture due to parathyroid carcinoma. Definition: parathyroid carcinoma is a rare cause of primary hyperparathyroidism and can manifest unmarkedly elevated parathyroid hormone levels. Since PC is functionally active, initial clinical barrier is similar to that of benign parathyroid neoplasm.
The majority of the time, parathyroid tumors are located in one of the four glands. A parathyroid tumor is, in most cases, a benign tumor that grows to an abnormal size. As it grows, it releases more parathyroid hormone, thus causing hyperparathyroidism. The tumor develops when there's a disturbance in the sensor on a single parathyroid cell. The thermostat level for the calcium changes to a higher number for that cell, while the remaining cells and glands stay at a lower normal setting. As the calcium level rises, the normal parathyroid cells and glands shut down, while the abnormal cell continues to produce PTH. Just like muscles, cells that work multiply and get bigger, while cells and glands that don't get smaller. Gradually in time, the calcium level increases until it reaches the set point of the abnormal parathyroid's thermostat setting. Because hyperparathyroidism is caused by the abnormality in the sensor, the high calcium level will continue as long as the abnormal parathyroid tissue is present.
Application in nursing. Nursing care is going to reduce the problem caused by the disease or this treatment. Nursing care for hypercalcemia resulting from parathyroid cancer might include the following: monitoring of the vitals influence medications that increase that amount of urine produced by the body, medication that prevent the body from absorbing calcium from the food that is eating, medication that stop the parathyroid gland from making parathyroid hormone.
Parathyroid carcinoma is a rare malignant neoplasm resulting in parathyroid adenoma to carcinoma progression. It forms in tissues of one or more of the parathyroid glands, four pea-sized glands in the neck that make parathyroid hormone, which helps the body store and use calcium. It is rare, and much less common than parathyroid adenoma. It can be difficult to excise. Parathyroid cancer occurs in midlife at the same rate in men and women. Conditions that appear to result in an increased risk of parathyroid cancer include multiple endocrine neoplasia type 1, autosomal dominant familial isolated hyperparathyroidism and hyperparathyroidism jaw tumor syndrome, which also is hereditary. Parathyroid cancer has also been associated with external radiation exposure, but most reports describe an association between radiation and the more common parathyroid adenoma. Most patients experience moderate to severe hypercalcemia and high parathyroid hormone levels. A large mass in the neck is often seen, and renal and bone abnormalities are common. Parathyroid carcinoma is sometimes diagnosed during surgery for primary hyperparathyroidism. If the surgeon suspects carcinoma based on severity or invasion of surrounding tissues by a firm parathyroid tumor, aggressive excision is performed, including the thyroid and surrounding tissues as necessary. Agents such as calcimimetics, for example, chinacalcet, are used to mimic calcium and are able to activate the parathyroid calcium sensing receptor, making the parathyroid gland think we have more calcium than we actually do, therefore lowering the calcium level, in an attempt to decrease the hypercalcemia.
Pros and cons. Pros. Some of these tumors are latent, they recur locally and persistently for several decades. Cons. If parathyroid carcinoma is not detected in time, it may have metastases.
Parathyroid cancer does exist, however, this is extremely rare. We estimate that this is about 1% of parathyroid patients that we see. And in that case, there are typically some associated symptoms or presentation patterns that come to lead us to the suspicion that this is parathyroid cancer. If somebody has parathyroid cancer, we likely see them present with a calcium level that's extremely elevated, on the order of 14 or 15, whereas most patients with primary hyperparathyroidism present with a calcium level in the high 10s to low 11s. We also can occasionally find intraoperative concerns for parathyroid cancer, but again, this is extremely rare, and most likely patients presenting with parathyroid disease do not have a diagnosis of cancer.
Usus applied in Ecuador. The calculated incidence is 0.16 per 100,000 inhabitants, with a prevalence of 0.5% corresponding to 125 and 10 million people. The median age of most surveys of between 45 and 61 years, and the ratio of affected women to men is 1 to 1.
While it is true that a rare cause of primary hyperparathyroidism is parathyroid cancer, parathyroid cancer is exceedingly rare. Sometimes we suspect that someone has cancer when their calcium levels are very high, and by very high I mean above 14 or 15, but the most common cause of primary hyperparathyroidism is just a benign growth of one of your parathyroid glands.
Conclusion. Parathyroid cancer must be taken into account in the differential diagnosis. In case of primary hyperparathyroidism, is patient with purple, neck maze, and severe hypercalcinemia. An early diagnosis allows better outcomes in this type of patient. Thank you.